Now, one of the commonly asked questions by the patients to me when I speak to them about deep brain stimulation is about the batteries. The question is usually along the lines of how long do you think this treatment will last? And the answer for this question depends on the kind of battery that we use when we do this surgery. There are two types of batteries that we have available with us. One is called a rechargeable battery and one is called a non-rechargeable battery. Now the question is, which one among this is better and how do we choose? Speaking first about the non-rechargeable battery, now this is a slightly more bulky battery which lasts anywhere between 3 to 5 years depending on the usage. Now the higher the frequency used, higher the amplitude of current and higher the pulse width, the less the life expectancy of this battery. But on an average, we would expect this battery to function for around a period of 5 years. The second option that we have is a rechargeable battery, which is thinner, more compact and smaller in size. Now this battery can last for up to 15 years after implantation. So how do we choose between these two batteries? And one of the things to keep in mind when we take this decision about non-rechargeable versus rechargeable is that the non-rechargeable battery doesn't require additional charging and it can be just inserted and left alone for 5 years for as long as it works. And after a period of 5 years when it runs out, it can be replaced with another battery with a simple surgery which only requires local anesthesia, and it is more of a daycare surgery. The rechargeable battery, on the other hand, though it has a long life of nearly 15 years, we have to understand that it has to be charged every twice or thrice a week, and this can be an additional burden on the caregiver. So these are the things that have to be kept in mind: the life expectancy of these batteries as well as the additional effort required before making the decision. For those patients who would prefer not to have repeated surgeries every 5 years, they can go ahead with the rechargeable ones, which just has to be implanted and will stay for 15 years. But of course, keeping in mind that it has to be charged every twice or thrice a week. The non-rechargeable battery gives us the advantage that you can just leave it alone for 5 years without having to worry about it and then get it replaced every 5 years.